We think this is a cancer, this leukemia CLL, which is driven by signals from the microenvironment. So the signals that cause proliferation of these cells are not coming from within the cell, but from outside. And the outside we call microenvironment. But that's just a general term, and what it means in reality is that there are various other cells around the leukemia cells which give them signals to grow and to survive. And we've lately very successfully brought into clinical practice new targeted agents as an alternative to chemotherapy, which are disrupting these interactions, this so-called crosstalk between the leukemia cells and the microenvironment. Those are kinase inhibitors, which are blocking signals that are coming from the microenvironment, and those have been very successful, have been approved, and are now widely used as an alternative to chemotherapy-based treatment. And that was kind of the key message of this presentation. There are different signals, so it's not just one pathway that is important, but one of the most important pathways is the so-called B-cell receptor signaling pathway. Every leukemia cell has a B-cell receptor, and that engages antigen within the microenvironment, and this signal promotes survival and growth of the cells. But just by itself, it's not going to be sufficient. It needs additional help from T lymphocytes, which activate the leukemia cells as well, and that's through a signaling pathway which is called CD40 ligand. There are also macrophages, which we call nurse-like cells, which also activate the leukemia cells. And other signals which are very important are so-called adhesion molecules and chemokines, which are signals that kind of retain the leukemia cells in these tissues. If you block those, then the cells are flushed out, go into the circulation, and that happens when you block these kinases with these novel kinase inhibitors. Then you see the cells leaving the lymph nodes, going into the peripheral blood, and then they are kind of deprived from these survival signals and eventually die. Multiple kinases are being targeted. The most prominent ones are the kinases BTK, or Bruton's tyrosine kinase, and PI3 kinase delta. We have approved drugs for both of them. And they are very similar, they are very close to each other in terms of the signaling pathway. There are small molecule inhibitors for both, and the clinical responses we see are very similar with both agents. There are differences in terms of toxicities, but the kind of response pattern is the same. So resistance to these agents is not frequent, but maybe 1 in 10 patients treated, at least if they had multiple prior treatments, will maybe become resistant. And we are just starting to understand the mechanism, and we don't have a good strategy how to treat these patients yet. But we and others have done studies to characterize resistant cells from these leukemia patients by for example, sequencing methodology, and are trying to find out if there are new targets or new ways to specifically go after these resistant cells. Besides the kinase inhibitors, I was talking about BCL2 antagonists. There's a drug which recently was approved in the US, which is called venetoclax, which is also interesting and not really a chemotherapy. It's very active, promising, and it uses again a different mechanism by targeting an anti-apoptotic molecule. It induces very rapid remissions, but also has some concern of side effect and toxicities, which are different from the kinase inhibitors. For example, we see a lot of neutropenia where the normal blood counts drop, and that can lead then to infectious complications. So They are good to have as an alternative, but are they going to be much better than the kinase inhibitors? There are pros and cons, I think, and we just have to see with longer follow-up which agents are going to be used, how frequent, and in which subset of patients. I think one conclusion would be to say if we understand the disease better, we can really develop better targeted agents, and these new kinase inhibitors are one example where science or discovery is around the disease mechanism lead to successful drug development. And the other message probably is these novel agents are so exciting, so successful, such a benefit for patients. So I was trying to convey that excitement to the audience as well.